Hello, my name is Dr. Dewan S. Raja. Today I will discuss about two genetic diseases. One is Prader-Willi syndrome, another one is Angelman syndrome. So what are the features of Prader-Willi syndrome? The Prader-Willi syndrome patient has hypogonadism, that is small testes, and in case of female, small ovary. Short stature, hypotonia, muscle tone is less, small hand and feet, profound hyperphagia after infancy. During infancy, difficulty to get food, and baby is difficult to feed the baby. Baby don't like to suck even because the baby muscles are very much hypotonic. So after infancy, there will be profound hyperphagia and there will be central obesity, mild developmental delay, learning disability. There will be behavioral problem may also present, and intellectual problem mildly present here. The problem is that this child used to eat a lot. They have profound hyperphagia and they take food around 3 times more than that of the normal child. Okay, so parental control to lock the cabinet and the food should be applied to prevent obesity. In addition to occupational support, also the physical therapy support, speech therapy support, food should be also regulated. In Angelman syndrome, clinical feature, microcephaly, head is small, macrosomia, face is large, mouth is large comparatively, excessive laughter, we can call inappropriate laughter, we may call it happy puppet, ataxia, jerky movement of the limbs and the trunk, seizure, convulsion, here we'll get severe mental retardation. Okay, these are the clinical features of Prader-Willi syndrome. Here are the clinical features of Angelman syndrome. If you go to the next slide, we'll get the image. This is from Medical Genetics, 5th edition, Jordi Carey Bumshad. Here is the child with Prader-Willi syndrome. Here is a child with Angelman syndrome, large mouth. Okay, and there will be seizure, mentally retarded, ataxic condition happen. Here there will be central obesity, voracious eater, learning and behavioral disability. Here more mental retardation than that of the Prader-Willi syndrome. Here the defect lies in the chromosome. Here the long arm of chromosome 15, that is the paternal chromosome, has deletion here. The active site, this red is the active site, deletion here. That is the Prader-Willi syndrome. Here deletion of the chromosome 15 of the mother, the active site is the Angelman syndrome gene here, that is the deleted part from the chromosome 5. Okay, so interstitial deletion of band Q12 is the locus in the long arm of chromosome 15, deletion 15, Q11 to Q13. Okay, so that happened. So Prader-Willi syndrome, here's the defect from the father. Okay, and here in case of Angelman syndrome, defect the deletion of the mother's long arm of the chromosome 15, particular locus here. Here also same locus area, and there will be deletion of about 4 to 5 millibars of chromosome. Okay, so both of them are very much identical in many respects. 1 in 15,000 person has Prader-Willi syndrome, like here, Angelman syndrome, almost same, maybe little variation. 1 in 15,000 person, deletion of about 4 to 5 millibar from the long arm of chromosome 15, same amount of deletion for the long arm of chromosome 15 of the mother. Here, the deletion of chromosome 15 of the father, deletion is inherited from the father, deletion is inherited from the mother. Deletion is responsible for 70% of the cases, like that, Angelman syndrome. Other mechanisms include what? Uniparental disomy. Suppose a child got both the chromosome 15 from the mother. In that condition, that child will develop Prader-Willi syndrome. Or if the child get both the chromosome number 15 from the father, then he will get the Angelman syndrome. Okay, this is another variety. This is different from 70% maximum condition like this. These are other mechanism like uniparental disomy. Okay, and point mutation, and another is defect imprinting control center of the chromosome 15. These all include 30%, and this include 70% in both cases. So deletion inherited from the mother, Angelman syndrome; deletion inherited from the father, Prader-Willi syndrome. More mental retardation, comparatively less mental retardation. Here, hyperphagia, excessive eating. Here there will be convulsion, seizure, ataxia. Okay, we got that. And that's all about the Angelman syndrome and Prader-Willi syndrome. Both cases, this child needs support from the parent, from the society, from the school, and get help from the physical therapist, from the occupational therapist, and from the speech therapist. So that's all about these two syndromes. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.